Okay, the question is, what is atypical facial pain and how is it treated? Alright, I don't use the term atypical facial pain. It's not a term I've ever really used. I saw a lot of referrals in practice and many more since I've been doing um, pain education and the pain and suffering seminars. But 90% of the cases I've seen ended up with a diagnosis. So those cases ended up being trigeminal neuralgia, glossopharyngeal neuralgia, a sinus tumor, dental abscesses, dental disease, sinus abscesses, atypical migraines, atypical headache syndromes, chronic sinus infections that from funguses, TMJ, even a lymphoma that involved multiple cranial nerves, viral damage that involved multiple cranial nerves. So I just call it facial pain that I don't know what it is yet. Facial pain unknown. Now, the term atypical facial pain is used by some as a psychogenic diagnosis. Warning, don't do surgery on these people because we don't know what they really have, or maybe it's psychiatric. I have never seen a case that ended up being psychogenic. So all the cases that presented to me in practice and all the cases I have followed and worked with as an educator, we have found a cause and therapy for. Chronic facial pain, when I've been in practice, the most common one I saw was trigeminal neuralgia behind migraine, and which I consider a head or facial pain. And then other cranial neuralgias and TMJ, dental disease. But probably when I was sent a consult, it was the fifth most common one was called atypical facial pain, which, in like I mentioned, we ended up with a diagnosis. Now, the cases that presented to me, I can see why they're difficult to diagnose because usually they were difficult to localize what was the cause. It's not the typical anatomic pattern, not a typical pattern of the nerves. Sometimes it crosses anatomic considerations. Sometimes it involves multiple nerves. It's usually chronic. There's typically some psychogenic component because anytime you've had a disorder and people are telling you it might be psychosomatic, or people are telling you they can't figure out what it is, and you're in pain all the time and people aren't finding a diagnosis, so they're not providing a therapy, you're going to have some psychological issues, on top of just the normal psychological issues of chronic pain. So the pain is usually pretty typical neuropathic when I've seen it. Dull, aching, crushing, burning, deep pressure. Um, so when I've dealt with this in the past, the number one thing is find the cause and then provide therapy for it. And we're going to discuss more about the therapies for trigeminal neuralgia and the neuralgias in the Triumph Over Persistent Pain seminar series today. And we're going to it'll be online as well on the member site. But, just what I usually do is choose one of the anti-epileptic drugs because usually it ends up being neuropathic. And if I get the idea that it's more neuropathic or less neuropathic, I may choose a different anti-epileptic drug. But typically, to reduce the excitability, help with the pain, something like trileptal or tegretol, I'll start. Get some counseling because this is a very stressful diagnosis to have when no one can figure out what's wrong, and, um, people telling you, like we mentioned, it's not. Uh, they don't provide therapy. They don't know if it's real. Um, make sure there's good support. Make sure they know that I will be diligent and persevere and find help, because usually in these cases I need help with imaging. I need help with a dentist or oral maxillofacial specialist. Sometimes an ear, nose, and throat doctor to look at the sinuses. So it's going to be very daunting task if multiple physicians haven't found out what it is. Sometimes this is the kind of case we'll bring to grand rounds. Now, if you're interested in learning more about trigeminal neuralgia, glossopharyngeal neuralgia, and all the facial pain syndromes and migraine and headache syndromes, give us feedback on mychronicpain.com in the member section or the free member section. We'll be glad to provide a seminar online for this if people are really interested. Okay? Did that answer your question? All right. Next question.